Good afternoon, everyone. Thank you for joining us today. My name is Katie Flores, and I will be moderating today. So if you have any questions throughout the presentation, we'll have time for that at the end. So just drop those either in the chat or you can use the Q&A button at the bottom of your screen. And now I would like to introduce Kimberly Knight. Kimberly is the Director of the Caregiver Support Program at the Senior Source.
Hey everyone, good afternoon. Thank you, Katie, for the introduction. As she said, my name is Kimberly Knight. I'm the Director of Caregiver Support here at the Senior Source, and we are excited to bring today's presentation to you. We're going to talk about a subject for many people that call us looking for help. They have many questions around, and that is around home care. Not home health care, but home care services. And so I will be introducing our speaker for the Eureka, Pinkney. But before I do so, I just want to share with you a little bit about the Caregiver Support Program here at the Senior Source, about our programs and services that we offer. For some of you, this may be your first time joining one of our education seminars, and for others, you may come every month. But we just want to kind of give new people kind of an introduction to who we are and what we do. And for those of you who've been with us, kind of a refresher, we would say. So the Senior Source is a nonprofit organization that has served Dallas County for 62 years at this point. And our mission here at the Senior Source is to improve the quality of life of older adults in Greater Dallas. And we do this every day through the programs and services we offer. The Caregiver Support Program is one of several programs that's here at the Senior Source. And through our program, our main goal is to do two things. Is to provide caregivers and solo agers. And solo agers are those of you who are aging in place at home by yourself with no family support or limited family support. Sometimes people's families move away, and so they're, here in I guess kind of the home state, so to speak, or the home state, and they're just figuring out the aging process with a little less family around. So we're here to serve you as well. But our two goals through this program is to provide resources and support to individuals and families so they feel confident in their role as a caregiver. And I'm going to add to that as a solo ager, right? Because there are many resources out here. And so sometimes when we need help, we don't know where to turn. And we want you to know that you can always call on the Caregiver Support Program here at the Senior Source. And then our second goal is to remind caregivers to put on their oxygen mask first by helping them to focus on their mental, physical, and emotional well-being. Because if you've ever been a caregiver or you know of a caregiver, you know how overwhelming the responsibilities and the role of a caregiver can get sometimes. And so we want the caregiver to know that we're here to support them, and that also to there are resources out there that can just help them in their day-to-day, make things a little easier. So, and help with their physical, mental, and emotional well-being in that respect. So those are our two goals as the Caregiver Support Program here at the Senior Source. Now, the programs and services that we offer several different things. One, the educational seminars that you're experiencing today is a service that we provide, right? Because there's so many resources out here. There's so many things to share with the caregiver. We wanted to create a platform where you could get that information easily. So we have educational seminars that we offer every month. If you go to our website, you can see our education calendar and see what next month's seminars will bring. In addition to that, we offer information and referral resources. So say, for instance, if you were looking for a wheelchair ramp, or if you wanted grab bars installed, or you were even looking for transportation to a doctor's appointment, that's something that we could assist you with by connecting you to a resource in the community that provided those services, right? So we could help you fill out that application or just give you the name and phone numbers of who to call so you can secure that service for yourself. In addition to that, we also do something called a care consultation. And that's something I kind of want to spend a little time talking about, because I think it is kind of one of the most valued services that we offer. It's right in line with a service you would get from, per se, a care manager, someone who specifically will sit down with you, our caregiver support specialist, and they would talk to you about your caregiving journey. They will hear about the challenges you're facing, as well as some of the rewards the benefits, the things that you've achieved throughout this process. And as they listen to you, they're going to provide you with resources based on your particular needs. The beauty about a care consultation often is that it's a time where families can come together, or if it's a solo ager, they can bring their friend group together, whoever their support system is, and we can have conversations about advanced care planning. We can have conversations about, I'm going into the hospital for this procedure and I need an aftercare plan for that. I'm not quite sure of what to do. Those are things that we can assist you with. Once you walk away from that care consultation, you will walk away with what we call a care plan. And that care plan is going to help you determine what you need to tackle first, second, and third, right? So if there are things you're at the beginning of this journey, you're not quite sure where to start, we're going to help you develop what your starting point would be and then kind of support you down that road. After the care consultation, we follow up with you between 3 and 5 business days just to see kind of where you're at. Have you started making those initial calls? Do you have any additional questions? Because once you start to talk to some of these agencies, sometimes more questions arise. So we're here to kind of be that sounding board and to answer any additional questions that you may have. In addition to the care consultation, we also provide incontinence supplies. I share with people now, we can't supply your needs for 365 days out of the year, but if you're in a financial pinch or there's some reason that you don't have incontinence supplies, we can definitely provide you with some that will last you at least 2 to 3 weeks. Until you get your next allotment of incontinence supplies to support you in that way. And then last but definitely not least, we have support groups. We have many, many support groups that we offer, from adult children to spouses to caregivers for the LGBT community. We have a Spanish language support group, and we also have a men's only support group because 40% of caregivers are now men. And so sometimes they have unique challenges, and men don't really like to kind of share how they feel. So once you get them talking, we definitely wanted to create a safe space for them to share their emotions. So those are all of the services that we have here at the Senior Source under the Caregiver Support Program. In this last year, we served 2,100 clients, and 84% of them reported they experienced less caregiver-related stress as a result of our services. And so that's something that we are very proud of here at the Senior Source through the Caregiver Support Program. So the next thing I just want to say, when it comes to being a caregiver, the reality is anyone can be a caregiver, and it can happen at any time. The reality is caregiving is not something we ever really planned for. And so most of the time, most of us are not prepared for it when it comes our way. One thing is for certain, at some point in your life, chances are you're going to be a caregiver. Whether you're doing it, full on 24 hours a day, 7 days a week, or if you're doing caregiving type functions like taking someone to the doctor, or taking them to run errands, or helping them to figure out how to pay their bills online. Those are caregiving duties. And so this is something that we need to kind of normalize having this conversation and let people know that there are services and resources out here like the Caregiver Support Program that can help them make these transitions as they are taking some of those beginning roles as a caregiver, or even if they're seasoned and they're just having a situation that they're not quite sure what to do with, that we could help them with that. So essentially, there are 2 types of caregivers. There are informal caregivers, also known as family caregivers. And those caregivers are typically untrained people who are assisting an individual with their activities of daily living or medical tasks. And then there are formal caregivers. These are typically trained, paid care providers that come into one's home and they provide various caregiving duties, again, assisting with those activities of daily living. These individuals can come from home care agencies, home health agencies, daycare, residential long-term care facilities. But the bottom line is they're typically paid trained care providers, and this is what their careers are in this area. So for my people who like just a little bit of stats about caregivers, this is just some of the stats that are out there. Traditionally, caregivers are still women, just because that's kind of like the gender role, that how things have just kind of been laid out in society. Women are kind of the nurturers or caretakers of the family, and we're still 60% of caregivers. But like I said, that number for men has increased, I know, significantly in the last 10 years or so. The average age of a caregiver is about 65 years older. However, caregiving, we're seeing more and more younger people become caregivers. We have a whole, we call them the sandwich generation, where they're caring for children and they're still working and they're caring for their adult parents. So that is something that's also on the rise. And then we have about 9% of caregivers that are LGBTQ. And lots of times in the LGBT community, they have what they called kind of a created family. It's not their biological family, but a family that they have created. And so oftentimes they step in and be each other's caregiver, but also to people who are a part of the LGBT community themselves may be caring for heterosexual parents. And so that's also something we don't necessarily think about. And then again, their needs are sometimes unique in that space as well. But we have 9% of that community that are now having caregiving needs as they are aging. So how do we know how we should get involved, or when is it time for us to get involved as a caregiver? And that's centered around, I like to say, these activities of daily living, or instrumental activities of daily living. These are our indicators as caregivers, adult children, family members, spouses, that it's time for us to get involved. So when we look at these things, these are the things that we do every day that kind of help us navigate our day. We're walking, we're eating, we're bathing, we're dressing ourselves. So when we notice that our loved ones are struggling in these areas, that as to where they used to once be able to walk through the home freely, now we're seeing that they're holding on to the wall or pieces of furniture to navigate through the home. That's an indicator for us as caregivers that this person might need an assistive device. Maybe they're having problems with their balance, or even kind of standing for long periods of time. Maybe it's a strength issue. But those are some of the things that we're going to look for as caregivers to let us know, hey, we need to kind of step in. Maybe there's something more going on here that we need to take a closer look at. Also, when it comes to dressing, does a person still have the ability to dress themselves? This is where we may notice with our loved ones, hygiene is starting to decline. Maybe they are not able to change their clothes or get out of their clothes as easily. Maybe there are some things going on with their vision, where they're having problems with depth perception. So the bathroom or the bathtub may be a scarier place for them than normal. Or maybe it's just they need a shower chair or bench, right? Maybe it's not that they can get in the tub anymore, but maybe that we need to do some things in the bathroom to make it a little bit more comfortable for them to take care of their hygiene needs. These are the things that we're going to look at. So our ADLs are indicators. Now our IADLs, they're also indicators, but they're the indicators, I like to say, that they come with kind of those flashing red lights, right? And I use that term because most of the time, if something happens with the IADLs, then either fire or police or some kind of emergency situation has taken place that brings that to the caregiver's attention. So driving is one of those things. If your loved one is starting to have more fender benders, like if they've had 3 accidents in the span of 2 weeks, right? Maybe it was other people, maybe they ran into the garage door. Those are things that we need to take a closer look at, right? Because that is something that could bring harm to themselves as well as to other people. Another thing would be medication management. If they are over medicating themselves because they don't realize that they took those pills already, or they under medicated, maybe they stopped taking the meds. Maybe again, they've gotten confused, or they didn't put them in their pill box for that week. And so they just didn't recall, hey, I needed to take my medication. Both of those scenarios could put us in a situation where EMTs have to come out. So you see what I mean by kind of the glaring red lights, because most of the time if something happens in the IADL category, that means it's an emergency situation. Someone else has to be called because our loved one is needing maybe some critical help or some critical care at that point. So those are the things we want to look at as caregivers. And if you're noticing these things and you have questions or you want to talk further, please feel free to reach out to the Caregiver Support Program, and we'd be more than happy to be that listening ear and to give you guidance as to how you should approach these things or just answer some basic questions for you. Now, here are all of those support groups I told you about earlier. Our support groups meet on the third Tuesday of every month at various times. Again, you can check our calendar on our website to see the exact times, but we have All In, that's for spouses. We have adult children support groups for the LGBTQ community. We have a Spanish language support group if they're Spanish speaking only. And then we also have a men's support group that's available at this time. Again, just know that as a caregiver support team, we are here for you. Here is how you would reach us. Our phone number is 214-823-5700. Our email address is C as in Charles, S as in Sam, P as in Paul @theseniorsource.org. This is how you would contact us. And here are some of the other programs we offer here at the Senior Source. We have the Elder Financial Safety Center. They can help answer questions about Medicare. It's Medicare open enrollment right now. So if you have questions, you could reach out to us and we could help you with that. They also do help with utility assistance. They have a open day of utility assistance, which is the second Wednesday of every month here at the Senior Source. You could bring your utility bills for TXU and I think also Ambit, and we could help with those. They do Garland utilities as well, and Atmos Gas. Those are the utilities that we cover. We also have a guardianship program. Guardians are court-appointed caregivers. There are just situations sometimes where the courts have to get involved and appoint a caregiver. And so the guardianship program is here at the Senior Source. We do offer that service. Then we have a long-term care ombudsman. Ombudsman is a funny word that just means advocate. And they are advocates for those who live in long-term care communities that sometimes may feel like they're not being treated right or they're not getting the things that they are expecting the staff to provide. And so the ombudsmen are here to take up those grievances and investigate and find solutions for those individuals who are living in long-term care communities. And then if you're just an older adult who is wanting to stay active and engaged in the community, we also offer volunteer programs through RSVP, foster grandparents, and our senior companion program here at the Senior Source. So any of those things you could plug into. If you want more information about them, you can go on our website at theseniorsource.org, or you can give us a call at 214-823-5700. All right. Are there any questions about anything that I just shared with you before I move on to introducing our speaker? All right. Are there any questions?
I don't see any questions so far.
All right, perfect. So I am going to just roll right into it, and I'm going to introduce our speaker for this afternoon. This is Miss Eureka Pinkney. She's a senior care consultant, but she's also the founder and executor of her organization. Eureka, give me your organization's name. You're muted.
I apologize for that.
No.
It is CareMate Wellness Solutions.
She is and I wanted to point that out, she's the founder of CareMate Wellness Solutions. And so you guys are getting 17 years of experience this afternoon talking about a very important topic, which is home care, not to be confused with home health care. And I'm going to let Eureka dive all into that. But this is a really, really important topic because this is something that we get calls about quite a bit. And so we want to clear up any confusion you have in this area. But Eureka is very passionate about this. Her background is 17 years of working in healthcare administration with UT Southwestern Medical Center. She took her passion for working in the medical field and channeled it into home care consulting. And from that, the business has sprung forward, and she's out here really helping people who are caregivers find ways to not get to a place of caregiver burnout. Because it can easily happen. They help with health and well-being for older adults and people with disabilities that need help navigating the maze of elder care services. Also recently, she is now a board member for APS of Tarrant County, and she said it was the Adult Protective Services Community Board. And so that board is all about being out in the community, letting people know more and more about adult protective services and the services they provide. Because I don't think people really understand the benefit of adult protective services. And sometimes, it's not all about getting people in trouble, right? But it's more so about kind of preventative, catching things before they get into that place to begin with, and providing those resources that older adults need. So I am going to stop talking. I'm going to turn it over to Eureka so that she can share more about home care. Thank you.
Thank you, Kimberly. As Kimberly said, my name is Eureka, and I am a senior advocate as well as a community health worker. And today, I will be talking to you about how to navigate the senior care maze. And if you bear with me just a moment, I'm going to share my screen so I can get the presentation going. Okay. All right, so yes, thank you for the opportunity to discuss how to navigate the senior care maze with you today. There is a lot of information out here about the different levels of services that are available. Today, we will briefly look at some of the options that are available. However, our emphasis will be on in-home care. The focus is on in-home care because the services can be used at any time it is needed, and it is the service level with virtually no restrictions. And when I say no restrictions, I'm speaking in the context of no restrictions on when they can start and how long they can last. So I'm going to open today with a question that has probably crossed the mind of anyone who is looking for senior care services for themselves or for a loved one. And that question is, do I age in place, or do I want to be admitted into a long-term care facility? Very important questions, because the level of care could differ depending on your choice. So what is home care and why is it important? So home care defined is the provision of comprehensive health services to individuals in their own home or residence for the purpose of promoting, maintaining, or restoring health or minimizing the effect of illness or disability. That's a mouthful, but that's what it is in a nutshell. So home care allows seniors and people who live with physical and mental disabilities to remain in their home while they receive care that is vital to their well-being. The main reason people consider using in-home care services versus some other level of service is because they want to remain in the comfort of their own homes, and the care is rendered on a more frequent basis than some of the other service options. And the cost of the care is also more effective and more manageable. Home care services support individuals who are chronically ill recovering from symptoms of illness, who are disabled, or they are simply at an age where everyday tasks have become a challenge for them. So of note, home care is not only for seniors. Many agencies work with adults aged 18 to 100 plus. If the person is dealing with any of the complications mentioned here and they are in the age range the agency accepts, they can benefit from in-home care services. Objectives of home care are, number one, to improve patient and clients' health outcomes as they age in place. Number two, prevent caregiver burnout and provide balance in the home. Number three, to provide mental health support through companionship services as well as cognitive stimulations. Studies show that social isolation can lead to depression in people who spend most of their time alone. Companionship services help alleviate these feelings of isolation, and moreover, these caregiving attendants are not just workers, but they become friends to their clients, which is super important in these circumstances. Home care services prevent readmissions to hospitals and, in some cases, prevent initial admissions. How is this done, you might ask? It is because the service is rendered more frequently than some of the other service lines and enables the agency to observe the client or patient more times in a week, up to 7 days a week, so that medical distress can be identified and addressed before the issue is out of control. So as you can see, home care services are a vital part of the care continuity. In almost all cases, the services keep patients and clients aligned with their healthcare obligations with respect to keeping doctor's appointments, staying on schedule with taking their medications, and monitoring for changes in health status, all in efforts of maintaining their overall health across their care plan or care continuum. While most agencies do not allow caregiving attendants to transport clients to and from doctor's appointments, as mentioned in the last bullet point here, they can certainly escort them and work with them and their families to help keep those appointments to begin with. How to qualify for services. So there are a few ways to pay for and qualify for home care services. And the first way that you can get your services paid for is if you have a long-term care insurance policy. If you hold an insurance policy with a provision for long-term care, you may call your carrier to activate the benefit. It is a 3-month process to approve. And if you are considering an agency to provide those services to you or your loved one, they may be able to help you tap into that policy to get your services covered 100%. Veterans or VA benefits. If you are a veteran or were married to a veteran, you may qualify for aid and attendant benefits or the PCS program. These programs are similar in nature, but the services rendered vary slightly. The benefit is usually administered through TriWest, and is part of the community care network. The approval process is from 30 to 90 days. It is important to note that to tap into this VA benefit, you need to be working with a VA doctor, because that doctor's order would be required to use the aid and attendant or PCS benefit. State benefit or Medicaid. If you are a Medicaid recipient or a participant in a waiver program, there is usually a provision for home care services included. If not, the approval process takes anywhere between 30 to 90 days for someone that's a brand new enrollee. It takes a while. It takes a while for the state to actually get the application and review it. But once they go through all their steps and you get approved, it will cover the services 100%. These are income-based programs, so certain requirements need to be met. Of note, Medicare does not cover home care services unless you are enrolled in a dual coverage plan, and you see MMP there in the parentheses. That stands for a Medicare Medicaid plan, and it's usually administered through a managed care Medicaid plan like Superior or United Healthcare or Molina. Those are just a few examples of what MMP plans are. Charitable organizations. There are many organizations that have programs in place that may help with payment for home care services if all options have been exhausted. Certain requirements may need to be met to qualify, depending on whatever agency you're already tied into to help pay for your benefit. Private pay. If none of these circumstances apply to you, private pay is always an option, but please do your due diligence and shop for an agency that meet your budget requirements. Agencies charge different prices and have different service hour minimums. What that means is most agencies require at least a 4-hour-a-day minimum, up to 12 hours a week. So the least amount of hours that you can be served in a day is 4 hours, and the minimum for the week is 12 hours. Differences in service types. Now, this is where it gets really important to understand the service line that you are thinking about utilizing for senior care for yourself or for your loved one. In-home care is going to provide that assistance with the activities of daily living, as Kim mentioned earlier. And all of the services are of a non-medical nature. This line of service does not require a doctor's order. Services can be provided at any time and until they are no longer needed. And care is provided by trained attendants or homemakers. And the activities of daily living cover the list that Kim mentioned earlier. That's bathing, dressing, light housekeeping, laundry services, medication reminders, mobility monitoring, and also medical observation. So there's quite a few tasks that are beneficial when receiving home care services. Home health care. Home health care is designed to continue hospital rehabilitation at home. A doctor's order is required, and the care is short-term, usually a few weeks and few visits per week. Recertification is a requirement. Care is provided by LMPs or licensed medical professionals, and this service is paid for by Medicare. So about the few visits per week, what that means is, let me just make a comparison here. So for in-home care, you can receive services 7 days a week and up to 8, 10, some people even do, or some agencies even provide 24-hour care. Now with home health care, you will get at best 3 visits per week, and there will be a nurse to come out to take care of any medical tasks, like if you're receiving wound care, or if you're a diabetic and you're getting finger sticks or blood pressure checks, they're going to do that. And they will also have an aide with them Now, the aide will make sure that you or your loved one is good to go for that day. They will help with cleaning you up. They won't do meal prep. They won't do light housekeeping. And the visit is probably going to last anywhere from an hour to an hour and a half. And as I stated earlier, you'll get between 1 and 3 visits per week with this service line. Hospice. Now, hospice supports patients and families, and it promotes a pain-free, comfortable environment near the end of life for the client or the patient. Licensed medical professionals provide the care in this service line. And again, you'll get 1 to 3 visits in a 7-day period. A doctor's note is required for this service line as well. Medicare will pay for a little while. And then once Medicare is exhausted, Medicaid, if the person is enrolled, will pick up the cost for the service. SNF or nursing homes, and SNF is skilled nursing facilities. A team of licensed medical professionals provide all services from each category mentioned here. A doctor's note is required for this service as well. The care is confined to that facility, but there is daily oversight and oversight 24 hours a day. Medicare and Medicaid pays for this service. So as you can see, here are the differences between the senior care services, and it is my opinion that in-home care still remains one of the top services to go with. Now, that does not mean that if you are using in-home care that you can't use any of the other service lines here. Well, obviously, if you're going to go to a nursing home, then that care is provided in a separate facility. But the good news is in-home care, home health care, and hospice can all exist in the same care continuum. Speaking of care continuum, so the continuum of care refers to maintaining continuous care for a patient as they move across multiple different caregivers, procedures, care facilities, and treatments. I want to focus your attention on the model here in the middle of the screen, with special emphasis on the outer band here for in-home care. If you notice, in-home care can be provided at the start of a situation all the way over to the end of life. So if a person is receiving home health care or hospice or palliative care, they can also have in-home care as well to complement these other service lines. Now, with in-home care, care may begin anytime a client or a patient has a care or companionship need to help the client aging in place. Home health is going to be medical skilled services in the home, which is nursing care, physical therapy, occupational therapy, speech therapy, and master social worker services. And as I mentioned earlier, aides will accompany these other workers here. They all work to support the patient in the home with their medical treatment plan, usually when they are released from the hospital or some sort of rehab facility. And then moving on past palliative care, you got hospice here, which is the end-of-life care supporting families and the patient to live an alert, pain-free life and live each day as fully as possible. So in total, what you see here is in-home care supporting the patient throughout the continuum. What can you expect before and while receiving home care services? We have 2 lists that I'll go through. The first list will be the list of expectations. You can definitely expect to receive a pre-care assessment. These are necessary because if you are working with or if you are considering a home care company to provide these services. Them doing a pre-care assessment will tell you a lot about what you can expect as far as the rest of the services. Pre-care assessment is going to allow them to come into the home, do a non-invasive assessment on the client. They'll talk with the family, and they will also evaluate the living environment as well. You can expect to receive clear communication about price, services, care plan, and an introduction to your attendant before services begin. You can expect to receive reliable, consistent, quality care according to the care plan that was discussed at the pre-care assessment stage. You can expect to be treated with dignity and respect from all involved in your care, including office staff. And a thing to remember is anybody that's coming into your home from an agency are visitors to your home. So it goes without saying that they should be respectful and treat you with dignity while they are in your home. And when you come in contact with the office staff, they should be warm, inviting, and knowledgeable. If they're not, then I would consider looking elsewhere or shopping, keep shopping for another agency. You can expect to receive the care outlines in your care plan as discussed and documented. Now, the list of things you are not to expect when receiving home care services. Don't expect to receive services outside of your documented care plan. Now, you see outside expert services in parentheses because many times a home care agency will come into the home, and even after they've done the pre-care assessment, they've done everything right, sometimes the client or maybe the family members, they can get confused about what the job is to be done once they get there. And I will give an example. Generally, home care services, they don't provide for transportation to and from doctor's offices or anywhere else. They don't do it due to liability issues. The family or the client will have the responsibility of finding transportation to these services. And home care service is not cleaning services. Now, we do come in and do lighthouse keeping. Our job is to maintain what has already been done. For instance, we've gone into homes where there are hoarding situations. Services generally won't begin until that has been rectified, and a good agency will provide the family or the client with a resource to help with a situation like that. So it's just a couple of examples. Attendants asking for favors. Not only is it unprofessional, but it's unethical. And if anyone is experiencing anything like this, this should be brought up with the agency administrator as soon as possible. Unfair treatment and substandard care. Absolute no-nos. Not having your concerns addressed. There is no reason that anyone should call an agency and not be able to get the information that they need, or not be received in a warm and courteous tone when they need help from their agency. Not having a supervisory visit on a regular basis. So generally, when home care is implemented in the home, depending on the care acuity for the clients, a supervisory visit is done between once a year and twice a year. And they're done because after 6 months of having services, the nurse for the agency is going to come out, make sure that the quality of care is high and it's consistent, and they will also reassess the client at that time to make sure that health outcomes are being met and to make sure that the client is not regressing or a situation has gotten worse. If something like that happens, then the onus is on the home care agency to communicate this information to the primary care provider, which is the doctor for the client, to get them addressed, to get those issues addressed sooner rather than later. Attributes of a well-rounded agency. Number one, they are resourceful. They have worked hard to build relationships outside of home care that will serve as resources for their clients. Many people that receive in-home care services have multi-level needs. If they need home modifications, their agency should be able to help them with a referral for that if they don't already have a referral source for that on their own. As well as, I'll give another example, if a client has a prosthetic that it's worn now and it's painful now and they are no longer in contact with the group that fitted them for the prosthetic to begin with, they ought to be able to go to their agency and say, hey, I need a referral for a new prosthetic. We're in the industry, we are expected to have these resources stored up for our clients. They are fiscally sound. They pay their bills and they pay their attendants for providing quality services to their clients. If they are not paying their attendants, the service is going to be substandard if the attendant even shows up at all. It's been a thing lately. Some agencies, they continue to operate and they promise their attendants that they're going to pay for the services that they provide to their clients, but either it takes them way too long to pay or they don't pay at all. And so what happens is the attendants, one, they stop coming, or they'll come, but the service is not up to par. And that is the number one complaint for a lot of people who switch agencies frequently. The agency cannot keep attendants because they're not paying them. Red flag all the way around. They are compliant. They are competent and experienced in the services that they are providing. Also, they meet all state requirements for operating each year, and they are structurally sound. And what that means is they have policies, procedures, and manpower in place to do what they say they do. So how do you vet an agency you are interested in working with? Some good places to start would be to read reviews. Now, a word of caution on reviews. You know, agencies can be doing everything right, but if they get that one client or a couple of clients, I would say, that don't get their way, then they would go on a tangent and fire off a negative review. Now, in the same breath, you go out and research an agency and read their reviews, and if you see a bunch of negative reviews and the reviews all speak to the same action, you might want to reconsider working with that agency. The other thing you want to know is, are they licensed? A lot of home care companies are operating without being licensed by the state of Texas. These agencies I would be weary of working with, and I would actually avoid them at all costs because they have no oversight. There is no accountability. Check the complaints against the agency to the state. And it's okay if you want to ask for a current client reference. They ought to give you several for that matter. Questions to ask. What do you charge if you are a private pay client? How do you vet your staff? Do you provide training for your staff? Have there been issues with paying staff, as we discussed a few minutes ago? Other things to consider. Ask about the procedure to file a complaint if necessary. And how will the attendant be evaluated? All these things are important because you want to make sure that one, they are offering training that keep the skills of their attendant relevant for the industry. And you just want to make sure that they have policy and procedure in place, and there is an escalation structure, and one person is not doing everything. So in summary, in-home care services help to improve health outcomes, improve mental health state, improve the quality of life for the client as well as their family caregivers. In-home care services prevent hospital readmissions, caregiving burnout, and elder abuse and neglect. So let's talk about caregiver burnout and some of the common signs of it. They are easily flustered or frustrated because they are simply overwhelmed. And if they are a person who is within that sandwich generation Kim spoke about earlier, they have their family that they're taking care of, their spouses, their children. Their children have extracurricular activities, and then they're caring for aging loved ones on top of that, and then trying to do things for themselves. It can be a bit overwhelming. And so they get easily flustered and frustrated because, number one, they may feel like they're not getting enough done, and they're looking for relief. They are extremely tired because the job is not easy. You know, as humans, we only have enough mind, enough energy to do so much. Taking care of ourselves and our own families is a lot, but then to add to that, taking care of our aging loved ones, it can be extremely overwhelming. They're typically uninterested in things that they used to enjoy because they are consumed with concern about caring for an aging loved one. They're forgetful or foggy because they're overwhelmed with the thoughts of everything that needs to be done for that aging loved one, themselves and their family. And they're quick to anger because sometimes they may feel like nobody understands what they're going through, or they don't see how they don't see the light at the end of the tunnel when it comes to caregiving. They can be anxious or depressed and have feelings of hopeless and helplessness. But I will say this, home care services, when they are provided correctly, they give that confidence. They give that confidence to family caregivers that they can go about with, you know, taking care of other things that are equally important to taking care of their loved ones without worry. If they knew that they had a company coming in that could alleviate them, let them go out and run errands, take care of the kids, do other things that are important, a lot of these symptoms would probably disappear or be lessened to a point of non-existent. So we have an activity that, well, it's a caregiver assessment. I call it an activity. We give this assessment to people who are primary family caregivers to help them gauge what their stress level is with respect to caregiving. Oh, sorry. And this is the form. Caregivers are often so concerned with caring for the relatives' needs that they lose sight of their own well-being. And so when we're given the form out, it takes just a few minutes to answer the questions. And then once people have answered the questions, there's a page 2 here that allows them to do a self-evaluation and determine what the response is. And the form asked them to just think about the past week. During the past week or so, I have had trouble keeping my mind on what I was doing, felt that I couldn't leave my relative alone. That's a lot of people. Had difficulty making decisions, felt completely overwhelmed, or if they felt useful and needed, they felt lonely. They've been upset that their relative has changed so much from his or her former self. They felt a loss of privacy and or personal time. They've been edgy or irritable. They've had sleep disturbed because of caring for a relative. They've had crying spells. They felt strained between work and family responsibilities. They've had back pain, which I know I can say for a fact that a lot of people have this issue because, like I mentioned earlier, the work is hard and there's a lot of moving and transferring and lifting involved with caring for aging loved ones. They felt ill with headaches, stomach problems, or common cold. They've been satisfied with the support that their family has given them. They found their relatives' living situation to be inconvenient or a barrier to care. And then number 17 is like a litmus question on a scale of 1 to 10, with 1 being not stressful to 10 being extremely stressful. Please rate your current level of stress. And a number goes in that blank. And then on a scale of 1 to 10, with 1 being very healthy to 10 being very ill, please rate your current health compared to what it was this time last year. And so this is page 2 of the form, and this is where you would do the self-evaluation and determine the score. And there are some instructions down below here, but I want to say that this form is going to be available to everyone on the call today. And when you do the assessment and you do find that you are dealing with a stressful situation with caregiving, I recommend that you consult with Kim at the Senior Source and her caregiving support team to get a referral to a good home care agency that can come out, do the assessment, and let you know how they can help you with your pains. So in a nutshell, and at the end of the day, in-home care services offer support, not only to the client, but to the family. In fact, I like to call the services lifestyle support and services that give primary family caregivers a break. We also offer education and guidance and help when it is needed. With that, I just want to say thank you for allowing me to talk about home care and its significance in our communities today. And we can open it up for Q&A. I will stop sharing my screen. And once again, thank you so much.
Thank you, Eureka. I did see one question about assisted living care. Is there a differentiation between the different types of care you discussed and assisted living care?
So for assisted living, it is exactly what it says. Assisted living communities usually have a full staff there to help the residents there with their everyday needs. Now, there are situations where the families will still consult with an outside agency if they don't feel that the services that they are receiving from that assisted living community is sufficient for what their family member needs.
And then could you, just to re-emphasize, I know you already talked about it, the main differences between home care versus home health care?
Okay, so home care is going to provide care up to 7 days a week for as many hours as the family needs or what they can afford, or if they are using a state benefit, all the hours that the state would allot for care. And a doctor's order is not required. The care can be started at any time, and they can go on for as long as needed. And they're going to do more than what we're going to offer, more than what home health care offers. Home health care, they're going to come in at best 3 times a week. They'll be there for maybe an hour to an hour and a half. They're going to take care of the skilled task, the aide that is accompanying that nurse or NP or whoever is coming. They're going to make sure that that client is good to go for that day. They'll make sure that they're clean, and they'll make sure that they eat while they're there. Now, with in-home care services, they're going to be there for, like I said, many more visits per week, and they stay longer, and they do many more tasks. They're going to make sure that they do meal prep. The client took their medicine, they're going to do laundry. If they need meds picked up, they'll go pick up the meds. They'll go get groceries, and they help with transfers and mobility monitoring.
Great. And then you talked about this too, but I have a good friend that's going through this, and her dad, I just texted her and I said, was your dad a veteran? And he was, and she did not know that there were special benefits to a veteran or a spouse. Can you cover a couple of those scenarios? Yeah.
Yeah, absolutely. The benefits can be utilized by the veteran, or if the veteran is no longer with us, the surviving spouse of the veteran. And yes, that benefit is called aid and attendant or personal care services. And so, as I mentioned, to tap into that benefit, they must be seeing a VA doctor, because that's the doctor that's going to write the order.
So if you're a spouse, would you, I'm not aware, are spouses of veterans allowed to use a veteran doctor?
Sure, absolutely.
Okay, good.
Absolutely. That's the good thing about it. The veteran and the spouse can both use the benefit if needed.
Okay, great. And then I wanted everyone to know that I did drop this self-assessment questionnaire into the chat. So please grab that and save it to your device if you can. And then Eureka, if they go through that questionnaire and realize that they are like needing the next steps, you recommend contacting the senior source first?
Yes, contact him and the team there. Let them know that you took that assessment. My number is high, and what to do next. And Kim can offer you some recommendations about a home care service that you can begin to vet and have them come out and do an assessment and talk to you about the needs.
Great. And I did drop the email address and phone number of the senior source into the chat if you guys want to grab that. Any other questions from our attendees? Oh, someone doesn't see the survey. I'll drop it back in there.
All right, I'm just going to say a few words. And if someone has a question, please feel free to chime in. But are there any? Well, I just want to say thank you, Eureka, for being here today and sharing such valuable information with us. Like I said at the start, this is a topic that we get many questions about here at the Senior Source through our caregiver support program. And I really, really, really appreciate you spending some time with us today and just kind of clearing up some of those I would say either misinformation or no information at all in the realm of home care services. We know it's something that's very much so needed. And so I would just say, if you are a caregiver and you're wondering if you need this service, if you have questions, you want to talk through it, the self-assessment Eureka provided is a great, I think, starting point to just kind of gauging just your own self-care needs in that realm, and that it's okay. You know, it's okay to to not be able to do it all yourself, right? I mean, and if you have someone coming in to help you, it doesn't make you not the caregiver. It just helps you to be a better caregiver, being less tired. I mean, there's so many things to do. It's just a way to share some of the work. So I just want to put that 2 cents out there, because sometimes as caregivers, we have a very hard time asking for help as well as receiving the help when we get it. So
Yes.
I'm going to turn it back over to Katie for some final housekeeping things and just say thank you again. And we look forward to seeing you next time.
Thank
Yes,
you.
thank you, Kim.
Just one last thing before we end today's webinar. There will be a survey that pops up on your screen after we end. And so please, if you don't mind taking a few minutes to fill that out for us, it just helps us to continue to bring you these great programs. I see one more question. Okay, I'm going to connect one of our attendees with you, Kimberly. She's seeking services, so I'll connect you too. All right, looks good. Thank you, everyone.
Thank you.
Bye.